Hello, I'm Jill Grawe, Medical Services Director for the Eye Associates. I'd like to review your post-op instructions starting post-op day 1 after surgery and going for 6 weeks following your surgery. The first thing that I'm going to ask that you do is to remember that you please do not press on the eye, scratch at the eye, or rub it. If your eye is tearing, if you put your drops in and they start to run down, we ask that you just gently pat underneath the eye or wait till it's on the cheekbone or below to wipe it away. Never press, scratch, or rub the eye. This is one of the reasons why our surgeons are going to ask that you use an eye shield when you're taking a nap during the day or you're retiring for the evening. The best way to put the shield on is to put the shield at an angle with a piece of tape across the top and a piece of tape across the bottom. If you put the tape in those two positions, it will not interfere with your depth perception if you have to get up to go to the restroom or get a drink of water. The good news is you'll be doing this day 1 after surgery and day 2 after surgery. The 3rd day following surgery, you won't have to use the eye shield anymore. Now, for the patients who have had the multifocal IOLs, these are the IOLs that allow you to see off at a distance, mid-range, and reduces your dependency on reading. The doctor or your surgeon will talk to you the day after surgery on what you can do with your reading while you're transitioning into your lenses. For the patients that had the max distance package or the standard implants, I know you're going to need help with reading. We will not be changing any glasses until 4 weeks after surgery. So let me give you some options to help you during this period. You can go ahead and put your old glasses on and leave them on. But if you do that, you may not notice how good your distance vision really is. So you may want to take your old glasses off and put them on when you want to read and use the reading portion of your glasses. You could take your old glasses off and try purchasing a pair of Plus 2.50 readers. The little half eyes that you can purchase over the counter, they can also be purchased in any one of our optical shops at the Eye Associates. If this is your first eye, and you know that you have a cataract in the other eye, or you may have had that cataract removed a long time ago, please talk to your physician at day 1 and they may recommend that you pop the lens out of the side of your glasses for the eye that just had surgery and go with nothing for that eye and keep your prescription in for the other eye that's either waiting to have surgery or may have had surgery a long time ago. Sometimes this option works and sometimes it doesn't. That's why you need to speak to your eye care provider at day 1. If you have your lens popped out and it's not working, our opticians will be glad to put that lens back in for you. The main thing is we won't be changing any glasses for 3 to 4 weeks after surgery, so use whatever you need to use to help you with reading during this period. You won't hurt the eye in any way. Please remember that. You will not hurt the eye in any way if you use any one of those options that we just gave you. You may use every one of them, or you may find one and stick with it till you get your new prescription, and that's just fine. Now let me talk to you about your medications. I know that you were given this great sheet of paper, and right on the right part of the sheet you will see it says cataract surgery drop schedule. The first thing you want to make sure is that you circled, or that it's been circled for you, if you had your left eye or your right eye done. The day 1 is always the day after surgery. So if you had your surgery on a Monday, then this of course would be Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, Monday. The same thing for week 2, same thing for week 3, and same thing for week 4. When I put the sheet down on the desk, the left eye will be for the left eye. The right eye is telling you to put them in the right eye. If you're having both eyes done in a close period of time, you'll be moving your drops between the sheets, and this will make things much easier for you. We're also going to ask that you use the drops in the order that they are listed. As you use the drops, you'll put a line through it. You also need to wait 10 to 15 minutes between each drop. If you don't wait that allotted time, then what will happen is the drops will dilute each other out and you will not get the benefit of the medication. So let me tell you what you're going to be using and why. The first medication that you will see is called Prolens Ax. This is for pain and inflammation. It is 1 drop at breakfast for 3 weeks. Please do not stop that medication on your own because it says that this drop is for pain and inflammation, and you are not having any pain or you're not having any inflammation. Please don't do that. This drop works on the front of the eye, but most importantly for you, it works on the back of the eye. So it's very important that you use this medication. The next medication is your Dura Saw. It is your anti-inflammatory. You will be using 1 drop at breakfast, lunch, and dinner for week 1. Then week 2 and 3 you drop down to twice a day, and then week 4 you drop down to once a day. The next medication is your Bestona. This is the medication that when you put it in your eye, it is very thick. It feels like it sticks to the eye. It also feels like it is sticking around the eyelids, and that is exactly what this medication should do. You will be using 1 drop at breakfast and dinner for 1 week only, and then you get to stop it. Some patients say that whenever they use this drop, it feels like a glue-like substance. It can have a little bit of discomfort or burning, and that is normal. A lot of patients will ask, why do you use something like Bestona? You've just had surgery to clear your vision, and now we're giving you a medication that is blurring your vision for about 10 to 15 minutes after you've used the medication. That is normal. This medication is the only antibiotic that is FDA approved to kill MRSA and MRSA, which are both superbugs that can be picked up anywhere. So with this medication though, please remember it's only 1 drop at breakfast and dinner for 1 week only, and then you get to stop it. If you follow this sheet of paper and every time you use that medication in the order that they are listed and cross it off, you'll be drop golden. A lot of patients will ask, am I going to have enough medications of the prescriptions to last? Well, if it takes 10 to get 1 in, no, you will need to have them refilled. Wherever you had your medications filled, there are refills on your prescriptions. So go ahead and have them filled. You don't need to purchase all of them. You'll only need to refill the medication that you need at the time. But now let's talk about a very important drop that you're going to be using that is not prescription. It's the lubricating drops. It's your tears. Right now at the Eye Associates, we are recommending Oasis. Oasis is a medical grade tear. It covers the cornea. It gives you much more coverage for dry eyes because you're going to have some dryness after cataract surgery. So let me tell you what you're going to be doing. We definitely want you to use the drops, 1 drop 4 times a day, breakfast, lunch, dinner, and bedtime, for a full 6 weeks. Now we do ask that we like for you to use a preservative-free. The preservative-frees come in individual vials, like this. You pop the top. You'll be using 1 drop, breakfast, lunch, dinner, and bedtime. Now this is a preservative-free, which means that there is absolutely no preservative in this. If you do not touch your lashes, the skin around your eye, your fingertip, it doesn't fall over on the counter, you can recap it. And then use it again at lunchtime. Same thing. But if you touched your lashes, your skin, your fingertip, then you have to throw whatever is remaining in the vial away. If you didn't, you can recap it and use it then at dinner. Same thing, recap it, use it at bedtime. Then at bedtime, if there's any left, you need to dispose of it. The Oasis Tears is, as I said earlier, a medical grade. This is going to give moisture back to your cornea. By giving moisture back to your cornea, you're going to have better healing. If the cornea heals better, you're going to have a better outcome. Your surgeon can do a beautiful surgery for you, but if you're not following their instructions, you may not get the maximum result. Now also, I know a lot of patients are really worried about the individual vials because some of you have a little trimmer and you're really worried because some of those edges on the vial are sharp. The Oasis does not have a sharp edge on the vial, but we now have a multi-dose Oasis preservative-free in a bottle. So you don't have to worry about if you touch your lashes or you touch the skin. This bottle, once you open it, it is good for 90 days. At that 90-day point, if you have any tears left, you need to throw it away. But for a lot of you, this is a wonderful option because you don't care for the preservative-free in the vial. Any one of these, the Oasis Tears Plus or the Oasis preservative-free multi-dose, can be purchased at any one of our checkout desks at any one of our offices. Now, let's also talk about checking your own vision. What we would like for you to do every day is check your own vision. And how you will do this is make sure you have your O glasses off. Please remember not to do this right after you've used your medications because that Besavance can blur the vision. Wait about a half an hour to an hour. Find something as simple as a clock on a wall. Maybe you have a family photograph or you have a favorite painting in your home. Take your O glasses off. Cover the eye that did not have surgery, and with the eye that had surgery, look at the object. First thing that you will notice after cataract surgery is brightness. Things are much brighter. Then colors. Colors are much more vivid. And then comes clarity. Please do not induce stress on yourself by thinking that today's vision is what you're left with at day 1, because remember, we don't change any glasses prescriptions for 3 to 4 weeks after surgery. So please give yourself a little time. If at any time you would have a sudden decrease in vision, severe pain, onset of redness and swelling, please do not wait. Once again, on your paperwork, on the very front of the sheet and the back, it gives you a number, 941-792-2020, or if you need the toll-free number, 1-866-865-2020. One of our doctors at the Eye Associates are always on call to take your calls. Please, if you have a sudden decrease in vision, severe pain, redness and swelling, don't wait. Pick up the phone and call us. Now, let me go over a few things that you can do. Of course, you can read, you can watch TV, you can work on a computer, go for a walk, enjoy your beautiful new vision. But this is not the time to go home and figure out that your kitchens and your bathrooms may not as clean as you thought they were the day before you had surgery. So if you say to yourself, should I be down scrubbing this floor? Should I be repainting this room that I had painted within the last year and the color isn't what you thought it was because of your cataract? You can have it painted, but we don't want you to paint it yourself. So all of your do's and your don'ts are always on the back sheet, but just read over those. This is going to keep you on that straight and narrow to give you the best possible outcome from surgery. If at any time you have any questions, please don't hesitate to call us. Once again, thank you, and I hope you enjoy your vision.